Platelet-rich plasma, or PRP, has become a popular treatment for osteoarthritis and tendinopathy. Clinicians and researchers often look for statistically significant results to guide their decisions. However, a growing concern has emerged regarding the use of trend statements in scientific literature. These statements are used to describe findings that are not statistically significant, yet are presented as if they might become significant with more data. This video explores how trend statements are used in PRP research, their frequency, and the potential impact on clinical decision-making. P-value is a statistical tool commonly used to determine whether a result is significant. Traditionally, a p-value below 0.05 is considered significant, suggesting that the observed difference is unlikely to be due to chance. However, p-values are heavily influenced by sample size and study design. Results close to but above 0.05 are often labeled as trends, almost significant, or trending towards significant. This practice can mislead readers into thinking that the findings are more meaningful than they actually are. Trend statement refers to the description of non-statistically significant results, as if they are moving towards significance. For example, a study might claim, PRP injections were found to be more effective than hyaluronic injections in improving functional scores, even though the difference was not statistically significant. The lack of a formal definition for trend in most articles adds to the confusion, making it difficult for readers to interpret the true meaning of these statements. Researchers reviewed original articles published on PubMed from 2014 to 2024 that examined PRP for osteoarthritis or tendinopathy. They searched for keywords like platelet-rich plasma, tendinopathy, arthritis, and more. Only studies directly investigating PRP's effects were included, while case reports, animal studies, and unrelated treatments were excluded. Each article was checked for trend statements, the number of such statements, and whether they acknowledged the lack of statistical significance. Out of 418 articles analyzed, trend statements appeared in 65 articles, representing 15.6% of the total. The rate is higher than in other specialties such as oncology, anesthesia, pediatrics, and orthopedics. Most trend statements were supportive of PRP, suggesting its effectiveness despite the lack of statistical significance. The presence or absence of a p-value was a significant predictor of whether a trend statement was made. Median sample size for studies without trend statements was 60, while those with trend statements had a median of 68. Interestingly, sample size did not predict whether a trend statement would be used or whether it would support PRP. This finding challenges the assumption that larger studies are more likely to produce significant results or avoid subjective trend statements. Trend statements often appear in the results sections of articles. Examples include phrases like, positive trend in pain reduction, or PRP-treated group trended toward a reduction in VAS at 3 and 6 months. These statements are used even when the results do not reach statistical significance. Authors sometimes acknowledge the lack of significance but still make conclusive statements about the trend. The impact factor of journals publishing PRP articles was not predictive of the presence of trend statements. Both groups, those with and without trend statements, had an average impact factor of 2.3. This suggests that the use of trend statements is not limited to lower-impact journals, but is widespread across the scientific literature. Trend statements are more common in PRP literature than in other medical fields. For example, the rate is 15.6% in PRP studies, compared to 8.7% in oncology, 6.4% in orthopedics, 4% in pediatrics, and 3.4% in anesthesia. This highlights a unique issue in PRP research, where subjective interpretation of data is more prevalent. Frequent use of trend statements in PRP literature can lead readers to draw incorrect conclusions. Many articles use these statements to promote PRP, even when the data is not statistically significant. This practice may influence clinical decisions and patient counseling, making it crucial for clinicians to critically evaluate the evidence. Interpreting PRP data is challenging due to variability in PRP composition, lack of standardization, and differences in delivery methods. Patient characteristics and study design further complicate the results. These complexities make it even more important to provide clear, objective descriptions of statistical findings and to avoid subjective trend statements. American Statistical Association recommends that scientific conclusions should not rely solely on p-value thresholds. A p-value does not reflect the importance of a result or provide a reliable measure of evidence for a hypothesis. Trend statements, which are often subjective, may display author bias and should be used with caution. Study focused exclusively on PRP for osteoarthritis and tendinopathy in human participants. Only peer-reviewed articles from PubMed were included, which may have excluded some relevant studies. The analysis did not deeply examine the methods and results of articles containing trend statements, so further research is needed to improve article quality and reporting standards. To address the issue of trend statements, researchers should clearly define trends in their methods or statistical analysis sections. They should describe p-values and note the differences between statistically significant results and subjective assessments of objective data. Transparent reporting will help readers make informed decisions and reduce the risk of misleading conclusions. Trend statements are frequently used in PRP literature to describe non-statistically significant findings. Their use can mislead readers and influence clinical decisions. The presence or absence of a p-value is a significant predictor of trend statement usage, while sample size and journal impact factor are not. To improve scientific reporting, researchers must provide clear definitions, acknowledge limitations, and distinguish between objective and subjective interpretations of data.